In this video presented by Overpsyched, we are going to review paranoid personality disorder. I'm Dr. Gerald Richardson, and let's begin with the objectives. We will first cover the diagnostic criteria, then explore some of the common features of paranoid personality disorder. We will then briefly compare paranoid personality disorder to other disorders, then discuss the prevalence, development, and course, and conclude with our current understanding regarding treatment. The DSM, or Diagnostic and Statistical Manual of Mental Disorders, defines paranoid personality disorder with the following diagnostic criteria. Criterion A pervasive distrust and suspiciousness of others such that their motives are interpreted as malevolent, beginning by early adulthood and present in a variety of contexts, as indicated by 4 or more of the following. 1. Suspects without sufficient basis that others are exploiting, harming, or deceiving him or her. 2. Is preoccupied with unjustified doubts about the loyalty or trustworthiness of friends or associates. 3. Is reluctant to confide in others because of unwarranted fear that the information will be used maliciously against him or her. 4. Reads hidden demeaning or threatening meanings into benign remarks or events. 5. Persistently bears grudges, that is unforgiving of insults, injuries, or slights. 6. Perceives attacks on his or her character or reputation that are not apparent to others, and is quick to react angrily or to counterattack. 7. Has recurrent suspicions without justification regarding fidelity of spouse or sexual partner. And criterion B does not occur exclusively during the course of schizophrenia, a bipolar disorder or depressive disorder with psychotic features, or another psychotic disorder, and is not attributable to the physiological effects of another medical condition. So now that we have our definition of paranoid personality disorder, let's review some of the common features. So individuals with paranoid personality disorder suspect with little evidence or basis that others may attack them or are plotting against them. They often feel deeply and irreversibly injured by others, and they may be very preoccupied with these concerns. They're very sensitive to any deviation from trustworthiness or loyalty. And similarly, they tend to be very amazed when someone displays loyalty, often to the point of not believing it or trusting it. Individuals with paranoid personality disorder may be hypervigilant for potential threats. They tend to be hesitant to share info or to open up to others, and they often are worried that any information they share may be used against them. Compliments are often misinterpreted, frequently as insults or criticisms. They may have difficulty receiving actual criticism, however, they are good at criticizing others. Individuals with paranoid personality disorder tend to bear grudges and are unwilling to forgive. They may blame others for their own shortcomings. These individuals tend to be self-sufficient and have a strong sense of autonomy, as they do not want to rely on others. They often want complete control in intimate relationships and may frequently ask about whereabouts, behaviors, intentions, and fidelity. For these above reasons, individuals with paranoid personality disorder may be difficult to get along with and frequently have difficulty with close relationships. So now let's take a moment to discuss some of the defenses that are observed in paranoid personality disorder. Due to their tendency to counterattack, they may frequently seek litigation and become involved in legal disputes. The malevolent motivations of others that individuals with paranoid personality disorder describe are often a projection of their own fears. They may also have grandiose fantasies that is a defense mechanism employed to give them a sense of power and rank. They may form tightly knit groups or cults with others who share their paranoid beliefs. And in periods of stress, individuals may experience transient psychotic episodes. There is a relation of paranoid personality disorder to schizophrenia, which we will discuss in a moment. And finally, their reduced capacity for meaningful emotional involvement may lead to isolation, and this isolation may have a quality like the isolation observed in schizoid personality disorder. Now let's review a practice question. A 34-year-old man presents to the psychiatrist with his wife, who says, "My husband needs help with his anger. Every time I talk to a man, he becomes very jealous. Every day he will ask me about where I was, despite knowing that I only go to work and come home. The patient replies, "I'm only here because my wife forced me to come. I can't have her turning her back on me too." The patient describes stress at work, explaining that he thinks his boss is going to fire him soon. He also stated that he has been staying home more frequently because his friends have been talking behind my back. Which of the following is the most likely diagnosis? So the answer is paranoid personality disorder, which is not too surprising since this is the topic of the video. But for those of you who are preparing for an exam that's related to psychiatry or psychology, this may be similar to a question that you might encounter. But if we remove this question from the context of a video on paranoid personality disorder, it may be difficult for one to come up with the correct answer because there are features in this clinical vignette that may match a diagnosis of delusional disorder or major depressive disorder with psychotic features, as well as some of the other personality disorders. So for that reason, I want to take some time to distinguish paranoid personality disorder from delusional disorder. The most common type of delusion is the persecutory type. There is no paranoid delusion. When someone is using that term, they're really referring to a persecutory type of delusion. So therefore, it can be difficult sometimes to differentiate paranoid personality disorder and delusional disorder. Do they have a personality disorder, or do they have a delusional disorder which includes some paranoid features? So let's return to the criteria for paranoid personality disorder. It is a pervasive pattern of distress in multiple domains in their life. The individual in the previous question, in that clinical vignette, had problems with his wife, his work, his boss, his friends, etc. Now, in delusional disorder, there may be multiple delusions. However, only one delusion persisting for 1 month or longer is required for the diagnosis of delusional disorder. But when there are multiple persecutory thoughts affecting multiple domains, which have been present for a substantial part of the person's life, paranoid personality disorder tends to be the more appropriate diagnosis. So again, it may be tough to differentiate a paranoid personality disorder from a delusional disorder that contains multiple persecutory delusions. So when you find yourself in that kind of situation, return to the diagnostic criteria for the disorders. And remember, paranoid personality disorder is a personality disorder. So with that comes all the things that come with a personality disorder, meaning it is a pervasive pattern that's affecting multiple domains in the individual's life. And it's typically long-lasting. And for the personality disorder, it requires evidence of beginning by early adulthood. Delusional disorder typically doesn't have this chronicity. So next, let's discuss the prevalence, development, and course. So the exact cause of paranoid personality disorder is uncertain. There are some links with schizophrenia. Paranoid personality disorder is thought to be part of the schizophrenic spectrum of disorders, which also includes schizoid and schizotypal personality disorders. These 3 personality disorders make up the cluster A personality disorders, and they have a link to schizophrenia. The prevalence of paranoid personality disorder varies based on the study, but it is estimated to be between 2 and about 4.4%. Some twin studies suggest that there is inheritability of this personality disorder. And some studies also suggest an increased prevalence in relatives with schizophrenia and delusional disorder. Paranoid personality disorder tends to first appear in childhood and adolescence, and it's demonstrated by poor peer relationships and hypersensitivity. It is more frequently diagnosed in males than females, and there is an increased risk of major depressive disorder, agoraphobia, and OCD. And the most common co-occurring personality disorders with paranoid personality disorder are schizotypal, schizoid, narcissistic, avoidant, and borderline personality disorders. Next, let's review some of the subtypes. These are not described in the DSM, but Theodore Millen described a few subtypes that you may encounter. First is obdurate paranoid. These are self-assertive, stubborn, or self-righteous individuals. Then there is fanatic paranoid. Grandiose delusions are irrational with extravagant claims and fantasies, pretentious and arrogant towards others. Then there is querulous paranoid, which are contentious, argumentative, resentful, or sullen individuals. Next is insular paranoid, characterized by reclusive, hypervigilant, and defensive. And finally is malignant paranoid, which is described as belligerent, intimidating, callous, and tyrannical. And the final topic in this video is treating paranoid personality disorder. Due to the suspiciousness and low levels of trust, individuals with paranoid personality disorder rarely seek treatment. Psychotherapy can be effective, but this requires the patient to be willing to engage. Medications have been tried with varying success. Antidepressants, antipsychotics, and anti-anxiety medications have been tried. These medications may be more efficacious when there are comorbid mood, anxiety, or psychotic symptoms. Antipsychotics appear to be more useful when used only in the short term. However, there still is no first-line medication approved for paranoid personality disorder. This concludes our discussion on paranoid personality disorder. Thank you for watching, and be sure to check out Overpsyched.com for more resources.